Today, we're going to tackle movements that help with lower back pain. So instead of too much tutorial style, we're really going to move, but it's a lot of breathing. So that's what we're going to bring to our session today. And I have a few props for you. So if you have one of these squishy balls or Pilates ball or something like that, use it. If you have these Franklin ball style balls, you can use them. If you have to pick between the two, whatever your preference is. And you don't have to have these. You do need a towel though. And you're gonna put it at one end of your mat and you're gonna come to resting on your side. So anytime we have a pain cycle, it triggers a whole thing in our body, like through your nervous system. So if you need the towel, pat it up as high as you need to take your arm or your head into a comfortable position, your bottom arm into a comfortable position. Let me get words out of my mouth. Knees will be bent. I want you to feel comfortable here, and I want you to take your top hand to your top rib cage. So what happens when we get into that pain cycle is we stop breathing. We stop breathing fully because we're kind of on high alert, right? It's triggering sympathetic nervous system, fight or flight, all of this stuff. It's great to have strategies for strengthening, but you also got to down regulate first. So that's where we're going to start. You're going to take your hands to your top rib. I'm taking it to that lower third. You're going to breathe in. And you're going to try and expand your breath into that side, front, back. Like when I got my hands wrapped around the bottom third of that rib cage, I'm going to try and expand there. Breathe in, breathe in, breathe in, breathe in, breathe in. And then as you exhale, don't force it down. Just feel how it naturally drops. Do that again. Inhale, 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 inhale. Exhale, 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 exhale. Take your hand up to the middle third. And you keep that lower third moving as you layer in the middle third. You inhale, inhale, inhale. Maybe a fourth inhale. And then as you exhale, at least 4 counts with your exhale. Inhale, inhale. Inhale, inhale, and then exhale, 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 exhale. And we're going to layer in the very top of the lungs and ribs. You're going to tuck your thumb into your armpit, fingertips right underneath your collarbones. I've got kind of the side of my arm at the side of my ribs so I can still get that feedback there. And you're going to inhale, 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 inhale. And exhale, 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 exhale. Inhale, 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 inhale. And exhale, 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 exhale. And then there's so much more we could do here, but we're going to keep it simple. We're just going to do that to come out of this. Right? If you're really in acute pain, you're really going to move slow and you're going to push through your arms. You're going to keep your spine pretty straight as you come up. You're just going to gently bring your legs around to the other side. And you're going to very gently lay yourself on the other side. Pat up however you need to. Right? Towel. No, maybe you don't need the towel. Don't use the towel. Use your arm. If you need your arm forward, take your arm forward. Top hand to that bottom third of the rib cage and knee. You almost you could feel a little like you're in the fetal position here. Right? Bring the knees forward and in a little bit. And then you're going to breathe in, focusing on your inhale, expanding where your hand is in this lower third of your rib cage. And then you exhale, exhale, exhale. And then you inhale, inhale, inhale. And then you exhale, exhale, exhale. Inhale, inhale, inhale. And then you exhale, exhale, exhale. And slide your hand up to the middle third. You inhale, you keep that lower third moving, you just layer on. And then you exhale. It's just awareness into, are you breathing? Are your ribs moving when you breathe? Are your lungs filling up? Right, just breathing as fully as you can. And then you slide your hand, thumb into the armpit, fingers underneath the collarbones. If you need more, You do more breaths in one area, and you're going to take that arm to the side of your body so you can still feel the side of those ribs, and you inhale, 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 and exhale, 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 exhale. Inhale, 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 inhale. Exhale, 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 exhale. And if you need more, you spend more time on this. Then you're going to come to rest on your back. You can use your head padding as you roll over to your back. Again, I'm trying to not twist my spine too much. Once you're on your back, if you want to, you can place the ball underneath your pelvis. If you do that, you really may not want your head support because you don't want to overstretch your neck. But if you're not using a prop, then by all means, keep your head support. I'm going to use these Franklin balls because that helps me with my very asymmetrical pelvis. And I'm taking them kind of opposite my femur there on each side of my butt cheeks, on either side of my sacrum. Again, you don't have to have this. And what we're going to do, of course, is continue breathing. So you're going to breathe in, and your belly, your back, your ribs are going to expand. So your whole torso has a slight expansion. And then as you exhale, you're going to let your belly hollow, and you're going to curl your pelvis under. So you want to roll your pelvis there. And then you're going to inhale, release. And sometimes it feels enough just to release back to where you started. Sometimes we need to practice taking the pelvis a little forward. And I want you to go with what feels good for your body. Like what's reading, like this feels safe. You're going to exhale, curl the pelvis under. Inhale, roll back to where you started. And if your body feels okay, it's okay for me to roll a little forward into what we call an anterior till you're going to roll anterior. You're going to do that again. I'm going to take the balls away and just feel my pelvis on the ground. I'm going to exhale, roll under. Make sure that even here sometimes people's ribs and their back is still staying like this. We're still gripping. Let it drop. If you find trouble, pat up your head, right? Let those ribs drop and just see if you can get your pelvis. Because when you get the pelvis going, it gives us a slight undulation in the spine, but also really importantly, it gets your hip joint moving because your pelvis is part of that joint that is your hip. And what a lot of time happens is we just tighten everything from our hip joint and pelvic floor and our pelvis into our lower back, into our thorax, into our ribs, right? So that's why I'm starting with the breath because of all the nervous system benefits of just breathing. But I started with an intentional choice of breath for your ribs moving because the rib cage movement plays a role in the compression in our lower back. And now we're addressing kind of the hip joint, but from the perspective of the pelvis. Rolling the pelvis under, right, which does shift my spine. And now my back should be able to relax. So just pause there and breathe. Let your back rest on the mat. You're not going to fall over here. You're not going to twinge anything here. You're safe, right? Tell yourself, remind yourself that right now you're not going to fall over. Your body doesn't have to worry about tipping over or picking up a heavy box or anything like that. And then you're going to release back to where you started with your pelvis. And if your body says it's okay, you're going to continue to roll forward on your inhale. One more like that. You're going to exhale under, curling into a posterior tilt. Back is relaxed. Inhale, tipping forward. And then I want you to find a happy medium. If you're using head support, slide it away because now we're going to talk about strategies to support your back using your legs. So we're going to practice glute bridging. You are going to press into your feet, pull slightly with your feet. I'm not tensing my back. I'm just going to push down through my feet. Even before I go anywhere, I haven't lifted my butt. I haven't done anything. I'm just active through my feet, my calves, my hamstrings. With that slight little pull, everything's already active. And I'm going to think about my legs, my feet, buttressing my pelvis. Like those hips are buttressing in and holding my pelvis and sacrum steady as I push down through my feet to lift up. Now, I'm going to hold when I lift a little bit. I'm going to make sure my ribs didn't whoop, my belly didn't whoop, go up to the ceiling and tense, right? I want to stay relaxed. You're going to push down there. You're going to breathe. And then you're going to pull slightly with your feet. Your hamstrings may not love that. You're going to pull slightly and you're going to roll down, massaging your back onto the ground. You're going to do that again. You're going to press into your feet and you're going to press, buttressing my pelvis. So it's like my legs are going to pick up my pelvis just a little bit. And I'm going to check in with my whole body. My ribs are dropped. My back is out of the equation. My legs should be doing this work. And you're going to push down through your feet. And I don't want you to come up super high. I just want you to wake up this foot to hip connection without your back getting involved. And when you come down, I want you to practice this gentle movement of your spine rolling down segmentally from your ribs to your tail. Now, you can keep doing this if this is the right call. If you want to shift strategies a little bit, you're going to layer in that pelvic tilt from earlier, exhaling and curling your belly under. Take a moment and take a deep breath in. Press through the feet and then exhale. Continue to curl the pelvis up so that your sits bones are lifting up to the backs of the thighs. The tail has lifted a little bit in between the knees, like it's aiming in between the knees, of course. And you're lifting. Again, still pushing through the feet, still using the hamstrings and glutes. We've just changed how we started that. And then again, I want you to breathe here. I want you to let your ribs drop in the front and widen in the back. Articulate through your spine as you roll down the best that you can today. And then release all the way to where you feel level. You're just going to do one more bridge of your choice, right? So whether you curl and articulate up and articulate down, or you do a little bit more static, hinge up, articulate down, it's totally up to you. If you curl under, is your pelvis moving evenly? What's happening in your legs when you press down through your feet? In either bridge, initiation, in either one, one side might be firing more than the other. See if they can get a little bit more even. How's the pressure in your feet? Come up as high as you feel like you're not going to strain your back. Pull slightly with the feet. Hello, my hamstrings are starting to cramp up a little bit, and that's okay. I'm going to let those ribs slide back. Let my spine articulate down, and my right hamstring just decided to wake up. Good morning. And then release and relax. Take a moment there. If you've got head support, slide it back underneath there. You're going to take your feet a little bit wider and take your arms out to the side, and you're very gently going to let your knees go one way. Now, if you just go a little bit and you're like, yeah, that's enough, just go a little bit, right? If you can go more by letting your bottom leg turn out and your top leg turn in, great. If you can, let your head look opposite those knees. And you'll get this nice stretch from shoulder to hip, even maybe into the lateral aspect of the thigh. On your exhale, don't arch your back away from the ground. You're going to see, can I pour myself back to center? Widening my ribs down, widening the back of my waist, bringing my pelvis, hit center with those knees up to the ceiling, and then go to the other side. The range that's right for you. Bottom leg turning out, top leg turning in. If you can, take your head opposite. Now, immediately, everything wants to go with that. So I'm going to only go as much as I can. Let my legs kind of pull my pelvis. I'm keeping the shoulder blade down. And I'm going to turn my head that direction to help that. And then remember that breathing into the side and the back of the ribs. You're going to use that as you breathe and come back to the mat. Abdominals have to wrap and pull you back. Coming all the way in. And then you're going to hug one knee into your chest, either grabbing the shin or the thigh. And then you're going to do the same with the other leg. And as you pull those legs in, your back will find the ground. And I want your shoulders to rest. I want your ribs to rest. I want your navel to kind of, almost like your organs fall back. Your navel falls back. And I want you to just kind of rock with the legs. So I'm just kind of bouncing my legs here. breathing. And then hug the knees into the chest. Take a deep breath in and a deep breath out. And we're going to bring the feet back down. And you're going to roll to your side. So on your side, again, pat up your head however you need. I'm just going to use my arm for my body. Your knees are going to be bent, feet stacked, knees stacked, so I can look down. I'm lining up with the back edge of my mat as I straighten my top leg out. You're going to look down the side of your body and go, okay, heel and ankle, knee, hip, pelvis, ribs, shoulders, head, all hopefully in alignment. You're going to reach to that top leg so much so that you feel like almost like the leg is getting a little stretch in the front of the hip, and you're going to keep that as you lift, and you're going to keep that as you lower. If you notice, I'm not going very high or not necessarily very low. I'm just trying to get this to where my pelvis is steady, my spine is long and as stable as I can get it, and I'm lifting and lower, strengthening my hip joint, this medial and lateral movement of the hip. So again, making sure that my hip can move, my hip joint can move, and my legs can be strong to prop me up basically, so I can stand on my legs and not stand on my back. We're going to inhale as you go up and exhale as you go down. One more like this. Inhaling up and exhaling down. Bring those legs together. Basics, right? Basics. You're going to press into your arms to come up, keeping protection in your spine, breathing. You're going to swing your legs or just gently take your legs around to the other side. Stretch out. Straighten that leg. Take a gander down the side of that from the foot all the way up to the head. Reach the leg a little bit longer, not overstretching the waist. I'm trying to keep my pelvis stacked, line from pubic bone to navel to breastbone taut. And you're going to reach that leg and lift. So I'm getting this fold in the side of my hip. And then as I lower down, I'll get a little bump out in the side of the hip. And then we lift and we lower. And what you don't want to feel is that every time you lift your leg, your waist shortens. And every time you lower, it lengthens and it lifts and it shortens. We don't want that today. We want to really get this hip joint mobile and strong so that your back does not do all of your standing and lifting and all that stuff. Most of us need stronger legs and more balanced range of motion and strength in our hip joints. And that will significantly reduce your back pain when you get that underneath you. One more or two, let's do two more. And are you breathing? You can apply that side breath that you started with at the beginning. All right, lift the leg up, bring it in, and we're going to come to our hands and knees. So once you're in your hands and knees, you're going to press your hands into the ground, press your knees into the ground, and you're going to notice if you immediately are super tucked, right? Are you still gripping in the pelvis and the spine and the hip joint? Or could it aim the space of your pelvic floor? Could that aim straight back as you push the ground away and get your belly a little active without overly tucking your butt, basically? And then what I want to do is you're going to exhale and curl your tail under. And then you're going to lift your lower back and around it. And then you're going to slowly, and I'm doing this really slow and mindfully, ripple through that rib cage. You might be like, oh, I've already lost my exhale. I'm done with the exhale part. But so maybe inhale, pause, inhale, exhale. Continue to go all the way to where your head is dropped out. So your tail is dropped and your head is dropped, and you just pause there. And you breathe. You breathe into that back space. Where is it the most tight on your back? Where has it been holding the most? Breathe into that area here. Exhale, lift the belly up a little bit more. And then slowly, you're going to go the other way. And again, this is going to be similar to those pelvic tilts. It's just more range, right? So it's more of your spine moving. So as your tail moves towards the ceiling, maybe for your body, you're like, it's just that pelvic floor flashlight aiming straight back. It's not going to go up. Like for me, sometimes that feels a little safer because I tend to over mobilize into extension, and then ripple into your lumbar spine, and then let your chest go forward, and then your head will go up. So your head and your tail are kind of lengthening and reaching away from each other there. And then I want you to find that happy medium where your pelvic floor, your pubic bone, your tailbone, and 2 sits bones are aiming straight back. Your hands are pushing the ground away. We're going to do a very classic physical therapist variation on bird dog, but we're going to do it really slow. So you're going to exhale, and you're going to think, I don't have to hike, shift, anything. I'm going to push through the floor, and I'm going to slide one leg back. I'm going to keep that foot on the ground because I might not be ready to lift it yet, right? And then I'm going to see, could I hold that? Can I keep those ribs lifted by pushing the ground away? Can I keep both sides of my waist long? Did I tuck? Can I breathe? And on your next exhale, slide the other arm away. Hold there. Keep everything connected. Maybe this is enough. If you can, you exhale and you lift that arm and leg out. I'm going for length and control of my center. Inhale, tap it down. Maybe just holding it there and taking deep breaths is enough. Exhale, reach and lift again. Go for length through the limbs, lift through the belly. Inhale down. Exhale, reach and lift. Bring it down. Bring the hand underneath you. Bring the leg underneath you. Take a minute. Did you really sling out to one side? Sometimes we don't notice until we come back to center. So calibrate. Breathe. Lift the belly. Slide the other foot back. Keep it on the ground. Breathe there. Slide the other arm out. Maybe this is enough today. Take a breath in and a breath out. If you're ready, exhale, reach and float the arm and leg out. Inhale, tap it down. Exhale, reach and lift. Inhale, tap it down. Exhale, reach and lift. Hold there. Bring the hand down. Bring the knees down. Separate the knees. Take the ball between your legs. Take your towel in between your arms. And then slowly you're going to round, but I don't think tuck. I'm thinking that long curve from head to tail. Press through your arms and slowly let your butt melt towards your feet, allowing this fascia between your ribs and your pelvis to yawn. Now, I don't want to overly tuck and overly stretch, especially if you've got disc issues. So I want a lot of rib cage and navel support as we go back. Slow. It's the world's slowest, most mindful child's pose transition you've ever done. Press into the arms because the shoulders integrate into that thoracolumbar fascia. And then once you're all the way down, then you can creepy crawl your hands away. Let your head find your towel. I'm going to find a good place on my towel. And the ball, you're just going to kind of hug the ball so there's a little activity still. Arms are still in their spider hands, reaching through, and you're going to hold here and you're going to breathe. Your belly will expand, but because you've got your thighs underneath you, your ribs and your back will have to expand too. Exhale, pull the belly in, let the ribs drop. 2 more breaths here, inhaling. See if you can spend a little bit more air, a little bit more yawn, stretch, breath, whatever you think, into those tight areas. Exhale. Now let your arms relax. Last breath. Exhale. Now, if you're acute in your back pain right now, you may be like, oh, coming out of this is going to be a beast. So what I want you to do is take your hands next to your legs. Draw a little belly support by hugging the ball. Pull the belly away from the thighs and push with your arms. Like use the strength of your arms. Press. And you're going to use that and you're going to look towards your pelvis. And you are going to feel your pelvis or see your pelvis roll upright before you even lift your head. Because if I just, I'm going to feel that strain in my back line. So I want you to get your pubic bone and tailbone reaching straight down. Hips, pubic bone level. And then I want you to get your ribs over that. And then when your ribcage to that, then you can get your shoulders and your neck and your head.
I hope this helps. I'll link some other classes below that address various ways that we can build core stability strength and integrate in with the breath, as well as hip mobility and pelvic floor work, right? So I'll put all of that in the description below, so you can explore that when you can, and hopefully you'll have an entire toolkit to use to keep you in a minimum amount of discomfort and pain, and at least you know what to do, maybe say at the end of the day or the beginning of the day, to mitigate your pain levels. All right, until next time, keep moving.